Good morning everyone. Myself Dr. Arya. Today I am going to talk about first trimester combined screening in pregnancy. Why are you going for this investigation? First and foremost, to know the risk of chromosomal abnormalities in the baby you are conceived with. When will you advise this investigation? The ideal time to do the first trimester combined screening is from 11 weeks to 13 plus 6 weeks. And you don't need to advise the investigation if the pregnancy is more than 14 weeks. The average rate in India is around 2,500 rupees. So from this investigations, we basically get to know the risk of your baby having chromosomal abnormalities such as Down syndrome, Edwards syndrome, and Petov syndromes. In these syndromes, the baby will be having decreased IQ, heart disease, renal disease, etc. Basically, we are assessing 3 parameters in this test. First and foremost is maternal age, and second is an ultrasound scan named NT-NP scan or early anomaly scan, and the third thing is dual marker, that is a blood test from the maternal blood. So with these 3 parameters, you will get to know whether your pregnancy is a low risk for trisomies or high risk for trisomies or intermediate risk. If it is a low risk, you don't need to worry about it and you can continue your pregnancy with the anomaly scan in 18 to 20 weeks. If you are a high risk woman, then you need to undergo certain diagnostic tests, that is such as amniocentesis or chorionic villus sampling. These are basically, this is invasive test with the help of an ultrasound. We will aspirate the amniotic fluid around the baby and we will run certain tests to know what exact issue is with the fetus. So as per the result, if the baby is positive for certain genetic diseases or syndromes, you can opt for abortions, or else if the baby is healthy and normal, you can continue with the pregnancy. If you're having intermediate risk, you have options of NIPT, that is, it is basically a blood test from the maternal blood. You will isolate the fetal DNA and check for the chromosomal diseases. So if it is again comes low risk, you can go forward with the 20th week anomaly scan, or if it is high risk, you again have to go for an amniocentesis. What are the other advantages of the first trimester combined screening is you will get to know whether you are high risk for developing hypertensive disorders of pregnancy in future. If you found high risk, then we can start you with certain medication so that you are less likely to develop hypertensive diseases of pregnancy in future. Other thing is, if you miss a dating scan, you will get to know the EDD, estimated date of delivery of your baby, and you also get to know how many babies you are conceived with, and you also get to know the placental abnormalities in the baby. So every pregnancy need to be optimized to have the best result. So I would definitely recommend, and ACOG recommends, first trimester combined screening for each and every pregnant woman. If you could afford it, you should definitely go for it. Have a healthy and happy pregnancy.